The amount of pressure that you need to give a certain flow rate really is determined by the size of the catheter and the flow rate you're trying to get. If you want to get a very high flow rate out of a catheter, you're going to have to use more pressure to get that. For example, let's say you had a 6 French pigtail catheter, you're doing a TAVR, and you want to be able to get a flow rate of 15 mLs per second. Well, you're going to have to develop probably close to 1,000 psi at the syringe end in order to have 15 mLs per second come out at the end of that pigtail catheter. Now, what comes out at the end of the pigtail catheter is not going to be 1,000 psi. All that pressure is going to be dissipated throughout the transmission of that fluid through the system by friction. But in order to get that flow rate, you're going to have a high pressure. The same is true if you use a 4 French catheter, for example. 4 French catheter, even a coronary catheter, you might have to have a little bit more pressure to get the same flow rate through a 4 French catheter as you would through a 6. You know, there are a few other things that are important. The viscosity of the contrast is important. So if you use, let's say, a 200 contrast versus 360 or 300, the viscosity is going to be a lot less. It doesn't take as much pressure to push that less viscous solution through the system. There's also another safety feature, and that is that there may be things in line which are really not rated to take high pressure. So the most common example of that would be a 2E.